Hi, my name is Fran Walboys. I'm the Clinical Director within Accelerate CIC. This video is about delivering compression which is non-standardised to a patient who needs something different. For this gentleman, we're going to demonstrate high compression. He has a history of deep vein thrombosis, and so he needs high compression to actually adjust for the venous hypertension. So after I've dressed the wound and just added extra protection, I'm going to apply the wadding layer. When we're bandaging the leg, the ankle's in dorsiflexion with the toes pointed towards the nose. I'm using a short stretch cohesive bandage, and this is an 8 centimetre width which conforms very nicely to the foot, and I'm going to apply it in with a figure of 8 pattern. And when I'm applying this bandage, I'm applying it at full stretch. And so this bandage is actually ideal for managing foot edema. And if I was concerned about the amount of edema on the foot, it would be a close weave figure of 8 that I would be doing. It conforms well, as you can see, and it just produces a semi-rigid cast around the leg. The next bandage I'm using is a 10 centimetre width, and I start with a turn at the ankle to anchor the bandage. You may note that I'm sort of more rolling it over the front of the leg, which is where the vulnerable tibial crest is, but I'm still having it on at full tension. I'm adding in a second cohesive short stretch, again from the ankle. I'm now going to apply some specialised strapping. This is actually to give it a stiffer surface and to add more compression to the site of the ulcer and where the edema is. This is to address areas which may not be achieving enough compression because a standardised bandage technique has been used, and so it's not actually addressing where the site of the edema is and where the ulcer is. And so is highly effective at creating that stiffer surface and just getting to the area of the limb where the bandage normally hammocks over. And if I was to measure the sub-bandage pressure at this point, the pressures would be very low, maybe 3 to 5 millimetres of mercury. So this really does give added compression to where you need it. So once I've laid down the first strap, it's just a matter of following the pattern through. And as I'm putting the strap on, I am actually pulling it at full tension. You'll also note that I'm not applying the straps across the leg or anywhere where I think it would give pressure over a bony prominence. And it's interesting that this can be really well tolerated. So this way you can see that we've actually covered the area that was ulcerated. We've also addressed all of the swelling around the ankle area as well. How does that feel?
Feel much better. Very good.
Feels better. Does it feel supportive?
Yes.
You'd think he'd be ready to go, but actually we haven't finished with the compression because he's a tall gentleman and he really needs just that bit more. So He is now going to put some hosiery on. Fantastic. This is a class 2, and this is a class 1 continental, and it's thigh length. So what does it feel like to have so much compression on? Because a lot of nurses would be quite scared of putting so much compression on.
Yeah, my strap a lot of clothing, especially on this leg. And I find that it helps the circulation. With the strapping, it helps quite a lot. Because when I put my leg down and I start to walk, that's why I can feel it's much more easier for me.
So I think it's very interesting that we do a lot of work around standardising our compression regimes, but there really is a group of patients who do need something more, and we need to be assessing what people's needs are. It's about knowing your craft, it's about knowing your tools, the bandage, it's about knowing what the science is underlying what you're doing, it's about knowing the anatomy, and then actually creating something out of that. And I think the aim is to be effective in what you're doing and not to keep doing the same thing day in, day out with no outcome. And so hopefully that's what we've achieved.
Yep.
It is about doing something different. It is also interesting to note how much compression can be delivered to a limb and applied safely and in an effective therapeutic way.